Now, when skin is exposed to the sun, our bodies make vitamin D, which helps the body absorb calcium for stronger, healthier bones. Although the sun does have its benefits, it also comes with its effects too, specifically side effects. And joining us this morning with more information on the importance of sun protection is Dr. Claudine Monstert, a general practitioner. Good morning, Doc, and welcome to Good Morning Namibia.
Good morning, nice to be here.
Now, we take it for granted that we need to protect our skins, although not all of us do that consistently. Help us understand in layperson's terms why we need to take care and good care of our skin.
Well, yes, that is so true. A lot of people don't know it. Our skin is the first contact we have on the outside world. And it's our first barrier that we have that we need to protect from germs and all the harsh things from the environment. And especially in Windhoek, where there's more industrial places, we don't know how much chemicals is in the world, in the environment around us, and that do harm to our skin, and it causes damage. And here at the coast, we see a lot of people outside, and it's fun, but it's fun in the sun just for a while, until we reach home and we see, oh no, we have a new skin color today. Yes, and that's why we need to protect our skin, because we so easily can get cancer or can get an infection that won't heal. So yeah, it's very important to take care of our skins.
Do I understand you correctly that it's not only the sun that we need protection from? Even if you remain indoors, you need to take good care of your skin throughout.
Yes, of course, because this is our barrier that we have for the germs and for everything that can make an entry for our general health. We need to protect it. And of course also for anti-aging. If we don't protect and take care of our skins, we can get lots of wrinkles. We know smile wrinkles are good, but yes, wrinkles, not all of us want that.
Please talk to us about the possible consequences of overexposure, particularly to the sun.
So the well-known side effect that can be caused by the sun is cancer. Cancer, skin cancer, it's a reality. And it's very harsh, and sometimes, even most of the times, it's picked up too late. And it can be prevented by just application of sunscreen and using sun-safe practices. So yes, skin cancer, there's different types where you can get the basal cell carcinoma and the squamous cell. That's just the different types of cells you can find on your skin. Also, the other well-known is the melanomas, because we have melanin in our skins. Some people have a little bit more and some less. Like people with fair skin have less melanin, and people with darker skin has more. And they say people with fair skin, because of that less melanin, they absorb the rays from the sun so much faster and it penetrates deeper. So people with a darker pigmented skin, that melanin helps them actually. That's why we have to have a lot of skin protection and to protect ourselves, to give ourselves that extra barrier.
But it doesn't mean that with darker pigmentation, you need not take care of your skin and that you're immune to skin cancer.
Not at all, because you still have a skin, you are still exposed to the sunlight, you still have that melanin, you can still get because you have more melanin, there's still that chance that can develop into a melanoma, carcinoma. Yes, so please, it doesn't matter. The sun doesn't discriminate anything. You still need to protect your skin.
As a general practitioner, depending on the severity, on the scope and magnitude of the condition, you would then recommend that a patient goes to see a dermatologist or an oncologist, depending on what is unfolding. But you would be the first stop. How prevalent do you is a skin condition brought about by overexposure to the sun?
Especially during these summer times, it is very often seen. We see about like at least 3 patients per week that have a suspicious mole or a suspicious lesion that we have to excise, send away. And that's where we come in as general practitioners. Yes, we are the first stop. We are the ones that has to identify. And we have to also educate the people, and that's important. People need to be knowledgeable about what's going on and what to look out for, because if the people don't know that I've been sunburned or this is a cancer lesion, then they won't come to us, and then it will become undetected, and the patient will present at the very late stage of cancer, where very little can be done to them.
Now, skin cancer is, of course, the unfortunate ultimate, but how dangerous is a once-off sunburn already?
At first, it's not that dangerous. It depends also on how severe the sunburn is, because yes, you can get blistering burns from the sun, and that's very harmful. And that's like when we talk about skin burn, we think always like with hot water or fire, and we say, oh, that's so bad, that's severe, the poor people. But even people with sunburn can get such bad damage. And most of the time, we don't realize it now, the damage that we are doing to our skins. But when we get older, then we see, oh, there's more freckles, there's more spots. And that's not from yesterday's quick tan in the sun. That's from our childhood years. So yes, that's the thing with the sun. It catches up on us when we don't expect it.
As lay people, we often don't understand what's happening. The sun in Windhoek, for instance, appears to be a lot harsher than it is here behind the clouds or on a misty day. Yet, the damage here seems to be more. I've heard a couple of colleagues say these past days that they appear to themselves a lot darker. What gives rise to the harsher burn here?
Well, people forget that we have the big ocean here that we can see, and mist is actually also a form of water. And our sun reflects on the water. And those reflections makes it far worse. So even if it's a misty morning at the coast, you still have to put on your sunscreen. You still have to remain during the safe hours inside your house, not outside. Yes, so that is why some people think, oh no, it's a nice covered day. No, it's much harsher because of that severe reflection from the sun within that water particles.
Doctor, you brought some goodies along to educate us on how to take better care of our skin. Please talk to us about what you brought with.
Okay, so first of all, like we're always, easy accessible sunscreen. I just brought this Helio Care, but it's not about the brand name. It's about what stands on it so that the people at home can know. A minimum here at the coast, especially at the coast, I would say a SPF 30. I have a 50 because I spend a lot more time outside here at the coast. So this is the sun protective factor. It does not say how many hours you can stay outside. It does not. This is the sun protective factor. It says how much it covers, percentage it covers when the sun is shining on you. And remember, always there's different types of rays. With our ultraviolet rays, you have the A and the B and the C. While C, we are covered from the UVC because our ozone protects us from it. It reflects the C waves away. But then the UVA rays, they cause us the aging.
Oh.
So there's where the wrinkles come in. So we need to protect for aging, and then the UVB rays is for burns, B for burns. So always make sure that your sunscreen has the UVA and B protections. Sometimes they don't specify, they would just say broad spectrum.
Is it a good idea to go for one that says broad spectrum, or should one rather stay away?
No, broad spectrum, that is the way to go. So always make sure and This is a bottle, there's things in, and it expires. So always make sure that the expiration date is still in date. And of course, when we are sweating, when we are going sunbathing, swimming in the ocean, these things come off. So it's recommended that every time after you went swimming, you reapply, and after 2 hours, you must reapply sunscreen.
And all over the exposed parts of your body.
All over. So that's why it's important to wear long-sleeved, not always short clothes, and make sure that the parts that are open and exposed, even if it's your toes, you have to put your sunscreen there.
Wow.
And your ears. We always forget about our ears. That's where our hats come in.
Just one moment before we proceed to the hat, doctor.
Yes.
I heard you say that the brand isn't that important. Does that mean I can go into any convenience store that's open 24 hours, 24/7, and purchase whatever I find on the shelf, and that'll work?
Yes, yes. You must just read what it says. Make sure you have at least a minimum of the SPF 30. The expiration date is still in place, and that you have a broad spectrum coverage.
Anything below 30 as far as SPF is concerned is a no-go.
Yes, that's when you go outside. People that work indoors most of the time, they can go for the SPF 15 when they're not so much outside. But still, when they're inside, they still need protection because the rays comes through the sun, through the windows. So you still get some exposure.
Very well. You had more goodies, doctor?
Yes, these hats are very lovely. I bought mine the other day. It is made from the Cancer Association from South Africa. So they have been nicely woven, so it also protects from the rays. And it's important, lots of us, we forget that the sun shines on our heads and we get the sunburn. So we need to put on our hats to protect our skin and our face, to get also nice protection from the sun rays, to not burn.
Especially those who may not have hair anymore.
Exactly.
Yeah. Or by choice.
Especially those, yes.
Doctor, if you established once you get home after a long day at the beach that, shoo, I may have burned heavily today, or this child looks like this child is in pain, how do I treat it at home?
All right, so first step is a nice lukewarm bath. So the person can cool down in the bath. It shouldn't be too hot or too cold. And then what I normally usually also put in is a bit of Epsom salt, which you can buy at any convenience store, and that just pulls out the burn sensation. And then moisturize. That is so important. Moisturize. Especially, you can use the products that has a bit of aloe vera in. It keeps the skin intact, and it moistures very well to protect from the harmful effects of sunburn.
What about petroleum jelly, Vaseline? Is that a good idea to moisturize with?
No, because that makes a thick layer. And when you go outside with petroleum jelly, that is like an oil layer, and it attracts actually more rays, and it focuses the rays on that skin area. So that may cause a bit of more harm. And also, what you also else can apply is simple prep cream. That it's normally used as a shaving cream, but that works just as well.
Thank you.
And also, for the pain, use something like an ibuprofen or a paracetamol.
Thank you, Doc.
Because there's always pain.
Thank you so much for your time, and thank you for sharing your expertise. It was such a delight to have you, Doctor.
Big pleasure, and thank you for having me.
Thank you, Doc. That was Dr. Claudine Monstert, a general practitioner based here at Swakopmund, teaching us how to take better care of our skins.